My name is Michelle Pullen, and I've had TMJ issues for over 20 years. Um, Started when I was in high school. I've had all kinds of appliances in my mouth, and braces, and I, what I do? um, I've had seizures from it, diagnosed with epilepsy. I've had limited opening, difficulty chewing and swallowing. Had a condylotomy surgery, um, and then because I was really dizzy and couldn't hardly open my mouth or eat at all or talk, and after that I was still dizzy, and then I was diagnosed with seizures. And well, before I was diagnosed with seizures, I saw an ENT and all kinds of doctors trying to figure out why I was dizzy, and so and having problems breathing. So they took out my tonsils and my adenoid and my uvula. And
that was a lot of fun, right?
yeah, and then I was still dizzy after that, and ended up going to a neurologist and then diagnosed with epilepsy. Um, then, um, let's see, fast forwarding, I came to Dr. Sims a few years ago when I lived in Maryland. I really liked him a lot, but we moved to Alabama, and my symptoms got a little bit better. But then after we moved down there, it got a lot worse, and I came back to Dr. Sims, January, February this year. And when I came to him, I could only open my mouth 18 millimeters, and I could hardly eat or swallow anything. In a few months' time, I lost 25 pounds, like in a month and a half or so, because I was hardly eating. I could hardly talk, and I'm a kid's pastor, so that made my job really hard. Really bad joint pain and shooting pains up my neck and my ear and the joint area. Yeah, and my shoulders. I actually couldn't lift my arms very much.
How high can you do that? Oh, amen. Go ahead, amen.
And I was seeing a chiropractor before I came to Dr. Sims also, which was very helpful, but I needed more with the TMJ area, and I knew that from Dr. Sims' research and seeing other patients, that you treated, that I felt like, and after praying, I felt like I really needed to come here. And my ears were really stuffy, and I had twitches, facial twitches, really bad, and lots of blinking, and eye twitches, really bad. I was even twitching in my shoulders, and sometimes, and my arm would jerk sometimes from it.
How's that now?
It's not happened at all anymore.
Very good.
Just after a few months with this, so. And headaches were really, really bad. I had headaches all the time.
How about your eyes? Were they sensitive to light?
Yes, my eyes are sensitive to light. Very much.
Stuffiness in your ears?
Yes. My ears are really stuffy, and actually hard to hear sometimes.
And now, since you've had this, 5 months? 4 months?
I got it Valentine's week.
So this is just about 5 months. How
5 months later, like this whole month, I only had like 2 headaches. They weren't too bad, and I had been like at the beach in the sun. So it wasn't related to the TMJ at all. And I've been really careful about not chewing, and I've been talking less, trying to rest my face, because before my face hurt all the time and my muscles just the little talking I'm doing right now, they would tire out so quickly. And I would just have to be quiet for a few days to recover from it. And so I don't have that problem now. I can talk.
So all those other things, how they've gone?
Yeah, I don't have any. I haven't had any twitches. I haven't had any shooting pains, any of that. Only just a little tenderness right here.
Okay, good. Excellent. So we're on the right road?
And I can open my mouth really wide
Yes.
for me.
No, that's fine. We went from 18 to what?
18 to 40.
In 5 months.
In 5 months, which is amazing. And even after having condylotomy surgery on my jaw before, I didn't open that far.
So you think we're doing
very awesome.
Good. I like to hear good news. Nothing but good news. All right. So we're gonna keep going. We're almost done. Huh?
Yes.
All right. And we thank God, don't we?
We do thank God every day.
Every day.
Okay, and I used to snore really, really bad, which is also one of the things that when I went to see an ENT, several years back, to try that to stop, and it did get some better, but then my jaw got a lot worse, and so I've been snoring so bad, like I went to a conference and a friend told me that I need to go because she's upset. My husband has sleep apnea, and I know you do too. But it was so bad, it would sound like a bear growling really loud. And even my kids could hear me upstairs, and I would wake up super duper tired. But since I started seeing Dr. Sims, I don't snore at all. Like right away, no snoring. And I wake up rested.
That's good.
Yeah.
And you mentioned it was difficult to breathe before.
Yeah, had a hard time breathing.
Even after you had the surgery.
Oh yeah, and just really tired all the time, feeling.
And now
I'm not feel like that at all. I sleep really well at night.
All right. So your husband likes you a little bit better.
He does.